be your doctor for your cranial nerve exam today. It's nice to meet you. Yeah. So before we get started, let me just check your chart really quick. Okay, and can I confirm your name and date of birth? Okay, great. All right, so we'll go ahead and get started. So there are 12 cranial nerves that we check for this exam. All right, so we're gonna just start with cranial nerve number 1. All right, so that has to do with our olfactory senses. So I need to grab a couple things for that, all right? Okay. All right, I have a couple of things here. Just put them down. I'm gonna put my gloves on, and then right after that, we will go ahead and get started. So, when we're testing the olfactory senses, we're first going to test how well you breathe out of both of your nostrils. So I'm going to hold this spatula up to your nose, and for all of these exams, I'm going to need to come in pretty close. Are you okay with that? Okay. So I'm going to hold this up to your nose, and with your mouth closed, I just want you to breathe on it, okay? And we'll take a look at the pattern afterwards. All right? Okay, here we go. All right. It looks like your airflow out of both nostrils is pretty good. And then next, I have a couple of scents here. And what I'm going to get you to do is you're going to hold one nostril closed, and you're going to breathe in, and you're going to identify the scent for me, okay? All right, let's start with this one. All right, so hold one of them closed. Okay. Lemon, very nice. And the other side, do you smell the same? All right, we're going to test that. I have one more scent, and we're going to start on the other side, okay? All right. Nice, it is vanilla. Okay, good. Now let me just write down some notes. Okay, and now I'm going to put my pieces back and get our next thing. Alright, this next test is for cranial nerve number 2, and I have here this Snellen chart, so let me get my pointer out here. So what I'm going to get you to do is I'm going to get you to cover one eye, and then we're going to read the lowest line that you can read. This bottom one? Okay. Very nice. And then switch eyes. Okay. This one right here. All right, go ahead. Very nice. All right, thank you. I'm going to go ahead and write that down for us. All right. All right, and now we're going to do cranial nerves 3, 4, and 6. So that is your ocular motor functions, trochlear, and abducens, okay? Alright, so what we're going to need for this is a pin light, and I want you to just follow the light with your eyes, okay? And I'm just going to move it, and then I'm going to watch your eyes as they move, and just see how it goes, okay? Alright. So let's see. Alright. And one more pass. Very nice job. Alright. Alright, so for cranial nerve number 5, we're going to be testing your trigeminal nerve. And I just need to grab a cotton ball for this. And the trigeminal nerve is testing your sensory and motor functions. So we're going to test your sensory functions first, okay? So I'm going to need you to close your eyes. And I have the little pointy stick. It's not sharp. And I have a little cotton ball, which is soft. And I'm going to touch different parts of your face. And I need you to tell me if you're feeling a sharp sensation or a soft sensation. All right? Okay, here we go. Soft. Sharp. Sharp. Soft. Soft. Good. Soft again. Yeah. And sharp. Very nice job. Alright, you can open your eyes. And I'm just gonna grab the things we need for our motor function test, okay? Alright, so for the motor function part of the test, I'm gonna need a knee hammer, but not just yet. First what I need you to do is close your mouth for me. And I'm gonna hold it closed, and I need you to just try and open for me. Good. Alright, and now I need you to clench your teeth. Not too hard, we don't want you to break a tooth. And I'm just gonna feel around your masseter muscles here. I'm looking for any asymmetry. Very nice. Alright, and now what I'm going to use the knee hammer for is I need you to hold your mouth just a little bit open. And I'm going to hit my thumb. My thumb's going to rest on your chin with the knee hammer. And we'll see what happens, okay? Alright, let's get in here. Very nice. Your mouth reflexively closed. Very nice. Alright, we are moving right along. So now we are at cranial nerve number 7, and that is our facial nerve functions. So what I need for you to do is to give me a really big smile. Alright, and then puff out your cheeks. Very nice. Can you raise your eyebrows? And then I need you to close your eyes for me, and I'm going to reach up and try and open them. Very nice. Alright. And then I need you to show me your teeth. Very nice job. Alright, I'm going to get a couple things for you to taste now, okay? Okay. taste test. Alright, so I'm going to put a couple of drops of different flavored things on your tongue. And you can tell me how they taste, okay? So stick out your tongue. I'm going to put one on one side and on the other. How is that? Salty. Good. And let's do this one. Alright. Bitter. Yeah, I'm sorry. And how about this one? Sour. Yeah. And this one. Sweet. Yeah. I like to end on a good note. All right. So let's see. I need to write down some notes for these last several. All right. All right. So for cranial nerve number 8, we're going to be doing several different hearing tests, okay? All right. So first what I want you to do is you're going to close your eyes and I'm going to hold my hands up to your ears and I'm going to rub my hands together and you're going to tell me which side you hear it on. So I'm going to do one and the other. All right? All right, here we go. Close your eyes. Good. 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 Great job. All right, and now what I'm going to do is I'm going to whisper several words and I want you to repeat them to me, okay? All right. Flutter. Flutter. Chocolate. Chocolate. Ting. Ting. Good. Button. Button. Very nice job. Great job. All right. So let me grab just a couple of things for our next set of tests, okay? All right. So for this next test, we're going to need a couple of tuning forks. And what I'm going to do is I'm going to ring the tuning fork. I'm going to touch it to the mastoid process. It's this little spot right behind your ear, all right? And then I'm going to move it next to your ear. And I need you to tell me which one is louder, okay? All right, ready? Okay, and next to your ear. Good, all right. You can hear it next to your ear louder. Good. All right. And then next to your ear. Same thing. All right. Then I have one more tuning fork. We're going to do that same thing, all right? This one's a little lower sounding. Yeah. Okay, good. And that doing something called the Weber test. And so I'm going to ring the tuning fork again, but this time I'm holding it right in the center of your forehead. And I need you to tell me if what you hear is a balanced sound. Do you hear one on more on one side, or is it just even all the way through? All right? All right. Even. All right. And this last one. Even through. Okay. All right. All right. And for this last part of the hearing test, I'm going to get you to look at the spot right here on my forehead. All right. And you're going to move your head from side to side without removing your eyes from that spot. All right? All right, go ahead. Yeah. All right. Have you noticed any dizziness, any vertigo, anything like that? Yeah. No? Okay. And you're able to keep your eyes right there on that spot I was noticing, so very good job. All right. All right, and now we're at cranial nerve 9 and 10. That is your glossal pharyngeal and vagus nerves. And before we do our tests, I want to just make sure I have everything written down on this chart from our last hearing test. All right. So for this test, the first thing I want for you to do is you're just going to open your mouth for me. Go, Yes. So your uvula stays midline, which is about what we want. All right. And then I need for you to stick out your tongue. All right. And I'm just going to push your tongue on each side. All right. All right. Very nice job. Thank you. All right. We are down to our last two. So for cranial nerve number 11, we're doing our spinal accessory nerve. And that involves our sternocleidomastoid muscles and our trapezius muscles. Okay? Alright, so for the sternocleidomastoid muscle, I need for you, I'm going to put my hand up on your cheek, just like that. And I'm going to try and push it, and I want you to push back against it. Very nice job. And for the other side. Great job. Alright, and now we're going to test out the trapezius muscle. So I'm going to actually need to come back around behind you for that. Alright? So I just need you to sit comfortably. I'm looking for any drooping or asymmetry. Okay, good. I'm just going to come around here. Alright, so we have made it to cranial nerve 12. That is our hypoglossal nerve. And there's just a couple of quick things to do for that one. Can you stick your tongue out for me? Nice. And now will you push your tongue against your cheek on the inside? And let me just provide some resistance. Alright. And the other side. Very nice. Alright, so let me go ahead and take down our notes from our last set. All right, so everything looks good. The only thing I noticed is that your right eye is not 2020. It is not too far from 2020, but you might want to get the eye doctor to check that out. All right, yes. So everything in our document today is going in your patient portal, and it was really great to meet you, and I'll see you sometime soon, okay?